So for those just joining, we have a lot of folks signed up for this, so we're just going to take a few minutes to make sure everyone has a chance to connect to today's webinar. Please do feel free to introduce yourself in the chat with your name, organization, where you're located, and if you want a little bit of the work you are doing. And I'll come back to this again, but for those of you who are familiar with the interpretation function, it's amazing these organizers of this session have pulled together interpretation in English, Spanish, French, and Romanian. And if you go to the bottom of your screen, again, I'll show this later, there's an interpretation button, and you can pick the language of your choice. We'll just give it one more minute for people to sign on. Thank you for your patience. So just to note, a bit of housekeeping, we have an example of the slide. I'm sorry, coming back to the one that was just up on interpretation. We have interpretation in English, Spanish, French, and Romanian. And please select that from the bottom of the screen, as you can see on this slide, and pick the language of your choice. Okay, well, please introduce yourselves in the chat, your name, your organization, the country you're working in, and a little bit about the work you're doing or your title. And make sure in the chat function that you select everyone to chat to in the webinar as the option, so they can all see your introduction. And for those coming on just now, you can only see speakers on the camera, and microphones will only work for the speakers today. And we'll talk about how we can engage in a dialogue momentarily. Margot, why don't we go ahead and get started? Well, welcome everybody to this presentation, this webinar on making an investment case for family care, and with a focus today on Moldova's experience. My name is Philip Goldman. I'm the president of Maestral International. I've been working on public finance and expenditure for roughly 3 decades, initially at the World Bank Group, and subsequently through numerous projects here at Maestral. So why am I here today? Frankly, I am so tired of decades of cutting-edge child protection work that's been sitting on the shelf, unutilized or underutilized for lack of resources. It seemed to me that every other development sector spends a lot of time engaging in costing and budgeting of their policies and initiatives, and child protection is very weak in this area. Well, I think our colleagues in Moldova have cracked the code and have shown us all a way for costing basic child protection and care reform services, and for making a strong case in investing in those services. I attended a convening in June of this year in Chisinau, Moldova, and it was extraordinary. It was fundamentally on what we're talking about today, making the case for investing in care reform. And it was a career highlight to be in the room. It was one of the best examples of combining technical work on care reform with advocacy for investing in care reform, one of the best convenings that I have experienced. So everybody, please stay tuned. This is going to be good today. And I'm very thankful that we have such a great team of presenters sharing this story with us. Next slide, please. So again, one final thought about introducing yourself in the chat, please. Please select panelists. Oh, sorry, please select everyone when sending a message so all can see it. This webinar is being recorded, and the recording will be made available to you in English, Spanish, French, and Romanian. If you speak more than one of those languages, you can watch the webinar more than once. We have a Q&A button at the bottom of the screen, and we'd like you to put your questions in the Q&A button. We won't be able to utilize microphones today, and please, as the webinar is proceeding, take the time to introduce questions or other observations or thoughts in that Q&A, so that by the time we get to that exchange, we'll have hopefully a rich set of questions for the panel to respond to. And one more time, to select the correct interpretation channel at the bottom of your screen to make sure that you're able to understand and participate effectively. Next slide, please. So this webinar is part of a series of webinars from the Transforming Children's Care Collaborative. The collaborative establishes more strategic sector-wide collaboration from global to local levels to strengthen children's care and care systems. And there's a link in the chat for you to sign up and to join the collaborative and to receive updates about future webinars. We promise you a good one today. I just want to plug these webinars across the board. They've been simply excellent and a fantastic opportunity to learn about child protection and care. So if you're not already a member, please take this opportunity to click the link in the chat. Next slide. So our agenda today, we have 4 presentations before we will have an exchange and a dialogue based on your Q&A submissions. The first, we'll look at an introduction to the investment case. Secondly, there'll be an analysis of recent developments in government expenditure and the costs per child in family type care and residential care. We'll hear an evaluation of financial resources in residential care institutions specifically. And then last but certainly not least, making the case for meeting Moldova's human capital needs. Next, please. So it's with pleasure that I'd like to introduce you to our first presenter, Ludmila Ungureanu, who is Chief of Party for Changing the Way We Care Moldova. Ludmila is a development policy professional with over 20 years of experience in organizational and program management, with a focus on social protection and good governance programs. Prior to joining the Changing the Way We Care initiative, she managed child protection programs with Terra de Om Moldova, decentralization policy reform programs with IREX, and civil society development programs with the American Bar Association and the Central Eastern Law Initiative. Ludmila, thank you for being with us today, and over to you.
Thank you so much, dear Philip, and thank you very much, dear colleagues from Better Care Network, for this opportunity to share our experience and some of our recent lessons learned. And I would start with the fact that, not surprising and surely not unique to Moldova, financing is one policy issue that everyone, all care reform stakeholders in Moldova, agreed is important. Local public authorities tasked by law in Moldova with preventing separation of families and providing family-based care share the sentiment and were vocal about their struggles in financing the services. The national government, specifically our colleagues at the Ministry of Labor and Social Protection, tasked with a new major reform of the social assistance system and taking over significant responsibilities for financing of social services in Moldova, we're looking to prioritize which services will be financed and offered as a matter of priority, recognizing that resources are limited and that insufficient financing of services in the past 20 or so years in Moldova has actually resulted in uneven access and often uneven quality of services provided to children and families. The Moldovan Ministry of Finance shared the sentiment, of course, and was vocal about the need to consider sustainability of social services and the need to justify any and all public investments. And there is civil society, which is vocal in calling the government to redirect resources from residential institutions to community and family-based care, and to follow through on its commitments made in Moldova and also internationally, including as part of the EU accession process to achieve 0 children in institutions. So about a year ago, we, Changing the Way We Care, several leading civil society organizations, our colleagues at UNICEF, the World Bank, Parliament of Moldova, and the Ministry of Labor and Social Protection decided to sponsor an informed and detailed policy conversation about financing for better care. Go from the general agreement about the importance of financing to an evidence-based discussion about what it means for Moldova in very practical terms. Based on evidence that we already had, including data collected by our colleagues at UNICEF, financial assessments of residential institutions, and you'll hear more about both of this evidence from our presenters today. Cost analysis reports and other research documents that we had, we agreed that we should make an investment case for a family-centered social welfare system, where carefully selected family and community-based services would be prioritized over institutional care, where case management took a center stage in ensuring that families benefit both from cash and care services as the most effective way to address complex vulnerabilities, and where the social services workforce was strengthened and supported to ensure the services are effective and reach those most in need. Together, we organized an international conference on financing for better care in June of this year that Philip attended, and continue to use the conference recommendations and conclusions in our advocacy and system strengthening efforts. Why we chose to make an investment case? Well, making an investment case responded to most policy agendas. It responded to the Ministry of Finance policy agenda of ensuring cost effectiveness and stewardship of public funds. Our data, which you'll hear about today, clearly show that there are both short and long-term economic and social benefits to shifting from residential care towards a family-centered social welfare system. The investment case also responded to the Ministry of Labor and Social Protection's need for selecting which services to prioritize. We carefully selected 5 services that address the need for prevention, family-based alternative care, and support services for children with disabilities, responding to numerous calls from civil society to create community-based services for children with disabilities and their families and prevent separation of these children precisely because communities lacked services. And as a way of conclusion, over the last 12 months, we took the policy conversation about financing of the care system in Moldova from general to specific. We organized it around an investment case for family care, and we collaborated around a unified and shared message: prioritize public funding towards families and family-based care. The conversation, however, is only starting, as Flor, my colleague from UNICEF, will confirm in her overview of the current situation in Moldova. While many recommendations in the investment case have since presentation implemented by the government of Moldova, included as related to the minimum package of services that was recommended by the investment case, prioritizing case management, and redirection of funds, the impact on budget allocations is less visible at this point. It will take continued efforts to ensure that the investment case for family care reaches a critical mass of policymakers, public and private donors, development partners, and other stakeholders before we see significant changes in funding allocations. We are very excited about the journey that we started and look forward to seeing the long-term impact of this conversation. Thank you so much. Philip, over to you.
Thank you, Ludmila, and thank you for all of your amazing work on pulling that convening together and all the work that's been happening since. I'd like to let you all know that at the end of this webinar, you'll be receiving an email with a link to resources, and that will include a link to a conference video summarizing what Ludmila has just mentioned, as well as other resources, a conference report. While we're talking about Moldova today, if you have a child protection or care reform program in your country and you are looking to get support for that and you've identified what needs to be done, believe me, the Moldova experience will be relevant for you. And so let's hear more about it from Flora Rossi. And Flora is a child protection specialist at UNICEF Moldova. She is a child protection and GBV specialist currently leading the child protection section in UNICEF Moldova. During the past 10 years, she lived in different countries around the world working on child protection and GBV, including in Israel, Palestine, Liberia, Haiti, the Democratic Republic of Congo, and in Iraq. She also spent a year in New York working in the Office of the Special Representative of the Secretary General for Children and Armed Conflict. Flora, thank you so much for being here today. Over to you.
Thanks a lot, Philippe, and good morning, good afternoon, dear participants. And I'm really happy to be with all of you today and to do this presentation on behalf of UNICEF. Next slide, please. So I'm going to do a presentation of the analysis that UNICEF recently did in Moldova. And the objective of this analysis of this budget brief that UNICEF conducted is to provide a better understanding of the government of Moldova spending towards foster care and residential care services for children deprived of parental care, as well as to estimate the cost per child of such services. So this analysis was intended and is intended to support advocacy efforts toward the closure of residential care institutions in Moldova, and this costing of, and it really helped UNICEF and the other child protection partners in the country to do a costing of the care reform and to build a case. And I think this budget brief, this analysis that UNICEF did, can be very relevant for other contexts and for other countries. And of course, in addition to this analysis, if needed, I'm happy to provide more details on the methodology used of this budget brief that can be helpful for the other contexts and other countries. Next slide, please. So before I start, I just would like to give a few elements in terms of the terminology. You will see in my presentation, I will talk about foster care and family type children's home. So in Moldova, there is the use of these two terminology. So foster care refers to family that welcome 1 to 3 children, and family type children's home refer to family also receiving, supporting 3 up to 7 children placed in this kind of family. So the both terminology are used, and I just want to specify this aspect before going into details in this analysis. In terms of context, I would like to give you elements of background. So at independence in 1991, as you are maybe aware, Moldova inherited a social welfare system with a system that was heavily based on a residential institution and quite harmful on children. In many cases, the institution had high rates of mortality, abuse, and neglect on children. In the past 15 years, the government of Moldova shifted from this legacy and has made significant progress in care reform and transitioning children from residential care institution to family-based care. And despite challenge faced in the provision of family-based care and still limited financial and human resources, Moldova is increasingly recognized as one of the best examples of childcare and protection reform in the region. And as you can see on the screen, progress has been made in reducing the number of children in institutions from more than 10,000 some 15 years ago to 600 in residential care in 2021, and this decrease is continuing in 2022 and 2023. As you can see on the graph with the blue line, on the contrary, we have an increasing number of children placed and benefiting from foster care and family type children's home. Next slide, please. So now let's look at the government expenditure on foster care and residential care. So we did this budget brief and this analysis for the period between 2017 and 2021. Before I start, just to give you an element that can be helpful, because you can see on the column that we are talking in Moldovan currency, in lei. So just to give you an element to understand, so when we talk about 60 million lei, approximately, we are talking about 3 million of US dollars. So few elements that I would like to highlight based on this graph that you can see. We can see that government expenditure on family type care and residential care has increased considerably over the 5 years to 2021. Family type care expenditure increased by 44%, whereas residential care expenditure by 41%. Spending has increased across all types of activities, through most notably in the community home services, more than 100%, foster care, 53.8%, and residential center for children with disability, almost 40%. I would like to insist on one important thing. When we look at throughout the period, spending on residential care was on average 1.8 times higher than the one on family type care. Next slide, please. But now, if we zoom to the type of expenditure per services, so we are looking more at details regarding how the government spends monies, is funding different type of services. So let's first have a look on the family type care expenditure. So for foster care, spending on foster care accounted for the largest share of the foster care spending at an average of 80%. The largest share of this amount constitutes staff costs, which refer to the salaries paid, the allowance paid to the foster parents. And it's important to highlight that this conclusion is drawn on the assumption that foster parents are employed through the year. For family type children's home, the spending has increased by 12% from 2017 and by 6.8% from 2020. Again, the largest share of this expenditure category is for the staff cost. Next slide, please. Now, let's have a look on the residential care expenditure for the same time, so 2017, 2021. So just to let you know, when we talk about residential care in Moldova, as in other countries, it gathers different structures. So there is the Center for Children with Disabilities, there is the Placement Center for Children, and the Community Home Services. So we look at these three types of institutions. So if we look at the expenditure, residential care spending has increased by 41% over the period from 2017 to 2021. And we can see that the operation of Center for Children with Disabilities accounted for the largest share of the residential care spending, almost 56% average of the spending. And we can see that this increase in terms of spending has increased for all types of residential care services. Next slide, please. So now let's analyze the cost per child. And I think this slide is extremely important to understand the dynamic. So over the 5 years, family type care cost per child increased by 34.7%. Cost per child in foster care increased by a significant 41%, whereas cost per child in family type children's home increased by a more modest 11.4%. But what is interesting to see, and I think it's clear when we look at the graph on the screen, by comparison, residential care cost per child increased by more than 188%. So we can see clearly a huge difference in terms of cost per child in residential care compared to foster care and family type children's home. Next slide. So all these findings, what these findings are telling us, how can I wrap up the main conclusion that we made following this budget brief, this analysis of the expenditure of the government? First of all, as I mentioned earlier, and it's important to recall this aspect, even if the number of children in residential care decreased, total government expenditure on residential care was 1.8 times higher than the one on foster care between 2017 and 2021. How can we explain this situation? So some of the difference in terms of expenditure can be explained by the profile of children receiving care. We know that in Moldova, approximately 8.7% of the children in foster care and 21% in residential care have a disability or had a disability. This implies that the care needs of children in residential care are greater, both in terms of specialized staff, but also special needs facilities. We also know that a greater number of children with severe disabilities are placed in residential care. However, the cost per child in residential care has been consistently higher than the cost per child in foster care, 1.2 times higher in 2017 and 2.8 times higher in 2021. And the situation is still the same today. So coupled with the number of children receiving care, this difference can be also explained to a greater extent by inefficiencies in adapting the cost to the number of beneficiaries. This reflects really the inefficiencies in reducing spending and adapting spending to a lower number of beneficiaries in residential care. And also a slight conclusion emerging from this analysis, unfortunately, is that there is no evidence showing that any saving have been realized from the transformation, closure of residential institution, and that saving have been relocated towards alternative family type services. So this is the main conclusion that we managed to have following this budget brief. And again, for us, it was really important because it helped to do the advocacy, to have better investment, cost efficiency in terms of investment in family type services, and to make sure that the saving can be relocated to the family type services. So thank you very much. I hope it was clear, and I'm happy to answer any question later on.
Thank you, Flora. That was great. And I can tell you the impact of those slides with all those policymakers in the room in Moldova, you know, from the different sector ministries and the World Bank and the other funders, was profound. Just to see so many fewer children in residential care and yet those costs skyrocketing. What a powerful message. So thank you for sharing that. Before we turn to our next speaker, I'd like to ask you all to help me out. I don't want to have to make up the questions at the end of this. We want to hear from you. And in order to do that, I'd like you to head down to that Q&A button at the bottom of your screen and start typing your questions and thoughts. So by the end of this, we can be hearing more from you. We've got almost 100 really excellent people on this webinar, and that's a lot of great, we want to hear from as many of you as we can. So let's move on to Daniela Mama Liga, who's the Director of Partnerships for Every Child Moldova. Daniela serves as the Director and President of the Alliance of NGOs active in child and family protection in Moldova. She has over 21 years of experience working in the civil society sector, providing technical assistance to the central and local governments of the Republic of Moldova in the development of child welfare policies and the implementation of child care reform, including deinstitutionalization of children, development of alternative family-based social services, and importantly, inclusive education. So Daniela, welcome, over to you.
Thank you, Philip. Hello, everyone. First of all, I would like to thank you for this great opportunity to share our country experience in reforming childcare. I am going to present the evaluation of financial resources in residential institutions that was carried out within the Changing the Way We Care initiative as part of the DI process relaunched in the country in 2021. Next slide, please. Next one, next. Thank you. So, why in the DI process when our main focus is on assessment of children and families, finding solutions for reintegration and appropriate support for families, on development of alternative services, have we decided to evaluate the financial resources of residential institutions? Why is it so important to do this type of evaluation? Next slide, please. The main response is that in such processes, we need evidence regarding the value for money of the funds allocated from the state budget for residential care. Therefore, the purpose of the evaluation was to inform political decision on the future of the 6 institutions under evaluation, including development of the transformation and reorganization plans for these 6 institutions. Next slide, please. The assessment objectives were to identify the annual cost per child in the residential institutions and the annual cost per child for the services in mainstream educational institutions and alternative social services. Next slide, please. So we assessed 6 residential institutions with different profiles, 2 auxiliary schools for children with learning disabilities, 2 placement centers for children with severe disabilities, and 2 placement centers for young children. The assessment methodology involved collecting data on spending per beneficiary, staff, assets, and educational and social services within residential institutions and nationally from 2018 to 2020. The methods include analyzing financial documents, collecting quantitative data, conducting interviews with relevant stakeholders, including those from the Ministry of Finance as well. The primary data sources were reports from residential institutions that were provided to the relevant ministries such as Ministry of Health, Ministry of Education and Research, Ministry of Labour and Social Protection and Family. Other relevant financial documents were also used depending on the type of institution. Next slide, please. So what were the findings? An analysis of the structure and proportion of the expenditure shows that in all 6 institutions, expenditure on staff is predominant. It accounts for between 60 and 84% of the total budget. Expenditure on the purchase of goods accounts for 11 to 26%, and maintenance costs are more or less similar. Next slide, please. In the same time, the analysis of the data has shown that despite the decrease in the number of children in residential care over the period of 2018-2020, the average cost per child has remained stable or even increased. This can be clearly seen in the graph, especially in the case of institutions for young children. And this is largely due to the fact that, as mentioned above, staffing and running costs dominate the total budget in residential care. Next slide, please. So when we analyzed the allocation for services provided in residential institutions, the results showed that most of the costs were related to care services, while the direct purpose for which these institutions were created was education or rehabilitation. For example, if you have a look at the expenditure on educational services in institutions for children with special educational needs, Bulwark and Winchester institutions, you will see that it is lower than the expenditure on care services. And the same situation is with other institutions. Next slide, please. Comparing the cost per child in residential services versus community-based services reveals significant discrepancies. So annually, one child in a baby home costs between $13,000 and $18,000, while in foster care, this cost represents only $2,500. In the auxiliary school, the cost of one child is ranging from $4,500 to $10,000, while in the mainstream school, it is only $1,000. A child with disability enrolled in a mainstream school with a specialized unit costs $4,000. Next slide, please. So what are the key findings? The main findings of the evaluation show that residential institutions for children with severe disabilities, which are supposed to focus mainly on rehabilitating children, spend only 1% on rehabilitation, between 5 to 10% on developing skills, and don't provide any educational services. At the same time, in special schools for children with special educational needs, auxiliary schools, only 36% of the cost are for educational services. This is actually double the cost per child in a regular school. Moreover, the cost of care services in these institutions is similar to that of foster care. Similarly, in baby homes, where one of the main reasons for the child placement is disability, the cost of rehabilitation services per child varies between 12 and 19%. Next slide, please. As you may have noticed already, the highest cost per child were found in the baby homes, ranging from $13,000 to around $19,000 per child. Personal costs remains the dominant part of the expenditure structure in all 6 institutions, accounting for up to 84% of the total budget. Meanwhile, the evaluation shows that the average annual cost per child increased in all 6 institutions over the 3 years, although the number of children and staff had decreased in general. In some institutions, the cost of care increased by more than 50% or even doubled. The key question that arises when analyzing all this data is whether the residential care system is efficient. And the evidence, unfortunately, strongly suggests that it is not. Next slide, please. The need for action is clear from all this evidence. In order to complete the DI process started in Moldova in 2007, we have to continue to reform the childcare system. And this includes reallocating resources to prevention and support services at community level and to family type services, strengthening gatekeeping and moratoria on new placement, especially when we speak about children aged 0 to 3, strengthening interagency cooperation for primary prevention, improving inclusive education, and building integrated services for children. And last but not least, we need political commitment to continue the reform. Of course, it is challenging in the crisis we are going through, but I think and I believe that it is possible. Thank you.
Daniela, that was just great and so informative. And, you know, there's a backstory here. What you just presented is actually an example of evidence that was that led to action. And so I wonder if you can please give us an example of how you were able to use this data to affect some real change on the ground in Moldova.
Based on our experience of working with 25 residential institutions that have been reorganized or closed down over the last decade, I would say that financial evidence is one of the most powerful argument in the DI process. So every time we have done this exercise, it has helped us in the reorganization process, as the figures speak from themselves in terms of the efficiency of the allocation of funds to childcare, and no further explanation is needed, in fact. A very recent example is the Hâncești Auxiliary School, which was closed last year within Changing the Way WK initiative. As soon as we had the preliminary data, assessment data, we shared them with the Ministry of Education and advocated very strongly for its closure. Of course, in all this process, in parallel, we ensured that we would provide all the support needed to reintegrate the children placed in these institutions with their families, to prepare the communities and schools for child inclusion. So clearly, an open, transparent, and trusting relationship with key stakeholders, government, residential institutions included, is essential in this process. And every time success is ensured.
Thank you so much, Daniela. That is great, and it is incredible to see how this work is leading to transformation. So thank you for sharing that. And with that, we'll come to our last presenter, and I am really excited about this one because what we'll be hearing is a way of presenting the case for investing in care reform in a way that we don't often see. So I'd like to welcome Constantine Gudima, who is the head of the finance department in Ochnita District Council. Constantine has over 25 years of professional experience in the field of public finance. Currently, he manages the work of the team of specialists of the finance department in the Ochnita District Council, which supports the elaboration, administration, and reporting of the budget of the Ochnita second level local public authority. In addition, he provides advice to local public authorities on issues related to the elaboration, administration, and reporting of the first level local budgets in Ochnita District. And he was a key member of the team doing the economic analysis for the June convening. So Constantine, welcome. Over to you.
Mulțumesc, Filip. Stimați participanți, bună ziua. În următoarele câteva minute o să vă prezint foarte succint principalele acțiuni și concluzii ale studiului numit Caz de investiții. Deci inspirația noastră pentru a dezvolta cazul de investiție a fost simplă. Noi am vrut să facem un argument economic pentru a investi în servicii sociale pentru copii și familii. Deci metodologia acestui studiu este în 5 trepte și începe cu evaluarea mecanismului actual de finanțare, inclusiv a modului în care finanțarea este canalizată către serviciile sociale și pachetul minim de servicii sociale. Al doilea pas a fost de a examina mijloacele ce se alocă acum în buget pentru copii, numărul de copii atinși de această alocare și tendințele alocării bugetare pentru copii în ultimii 3 ani. De asemenea, au fost studiate alocările bugetare și cheltuielile pe perioada 2020-2023 pentru îngrijire rezidențială a copiilor în 6 instituții finanțate la nivel central. Al treilea pas a definit ce este inclus în pachetul minim de servicii propus și ce părți sunt finanțate, ce servicii nu sunt finanțate în mod adecvat. Aceste informații au fost colectate în urma analizei cadrului normativ, precum și din interviuri cu furnizorii de servicii și alte părți interesate. Al patrulea pas a fost estimarea costului serviciilor incluse în pachetul minim de servicii propus la un nivel avansat de detalii și compararea lui cu alocarea curentă pentru a identifica decalajul. Iar pasul final a fost folosirea îndrumărilor globale și determinarea rentabilității estimate a investiției și potențialelor economiei guvernamentale. Următorul slide, vă rog. Deci, Puțin din istorie, Moldova a adoptat o legislație care include un pachet minim de servicii pentru copii ce au nevoie de îngrijire în anul 2012. Însă, acest pachet minim nu a fost posibil de dezvoltat uniform pe teritoriul țării, din cauza autonomiei locale, posibilităților financiare diferite și prioritizării cheltuielilor la nivel local în mod diferit. În procesul de lucru al echipei asupra cazului de investiții, deci noi am convenit să facem cercetarea pe baza a 5 servicii din acea listă. Aceste servicii sunt sprijinul familiei cu copii, asistență parentală profesionistă, asistență personală, echipa mobilă și servicii de răgaz Respiro. Acest pachet de servicii a fost selectat deoarece oferă o gamă largă de servicii care vizează atât prevenirea separării sau consolidarea familiei, cât și răspunsul. Și toate au scopul de a sprijini familiile să îngrijească copiii, inclusiv și cei cu dizabilități, în familii sigure și îngrijitoare. Următorul slide, vă rog. Deci, în urma analizei cheltuielilor în domeniul asistenței sociale, deci putem constata că în ciuda șocurilor macroeconomice asociate cu pandemia COVID-19, finanțarea pentru cele 5 servicii din pachetul minim propus a crescut de la an la an, așa cum se vede în graficul din stânga. Totuși, bugetul public național a crescut mai repede decât bugetul dedicat serviciilor sociale respective. Acest lucru se observă în graficul din dreapta. Următorul slide, vă rog. Privire la instituțiile rezidențiale, deci finanțarea instituțiilor rezidențiale de asemenea a crescut, chiar dacă numărul copiilor din instituții rezidențiale continuă să scadă. Aceasta înseamnă că țintim doar o parte din copiii aflați în nevoie. De exemplu, în anul 2023, Guvernul Moldovei a alocat $8 milioane pentru instituțiile rezidențiale, ceea ce echivalează cu 0,2% din bugetul de stat. Aceasta totodată reprezintă o creștere de 68% a cheltuielilor față de anul 2020. În mod similar, și costul mediu per copil în îngrijire rezidențială a crescut, de la $8.725 în 2020 la $13.154 în 2023. Următorul slide. Când discutăm despre echitate și eficiență și despre ce este bine pentru copii, atunci când oferim servicii familiilor și copiilor, trebuie să ne asigurăm că nu doar investim rațional, ci că avem o acoperire mai largă pentru toți copiii care au nevoie și nu doar pentru unii copii. De servicii mai puțin costisitoare beneficiază mai mulți copii în comparație cu serviciile care cauzează potențiale prejudicii. Pachetul minim de servicii propus pentru protecția familiei și a copilului reprezintă o modalitate eficientă din punct de vedere al costurilor de a sprijini copiii și familiile vulnerabile. Am estimat că va costa circa $944 per copil, ceea ce este de 14 ori mai puțin costisitor decât costul plasării unui copil în îngrijire rezidențială, $13.462 per copil, și de 19,7 ori mai puțin costisitor decât costul furnizării de servicii copiilor cu dizabilități plasați în îngrijire rezidențială, sau $18.626 per copil. Deci, diferența este foarte mare, dar acest cost mic se datorează prezenței în acest pachet minim a serviciului sprijin familiei cu copii, unde sunt cei mai mulți beneficiari și cele mai mici costuri, și care este un serviciu de prevenire a separării copilului de familie. Următorul slide. Pentru a elabora costurile pachetului minim de servicii sociale propus, am folosit datele privind bugetul și cheltuielile Republicii Moldova și am dezvoltat un model de costuri în Excel. Am definit serviciile, activitățile din cadrul lor și ce finanțare lipsește. Iar apoi am definit o listă de prețuri a bunurilor și serviciilor necesare pentru activitățile de prestare a serviciilor sociale. A urmat definirea frecvențelor și cantităților necesare de bunuri, pentru fiecare activitate din cadrul serviciilor sociale, fiind obținut costul nou al fiecărui serviciu social, inclusiv costurile de dezvoltare. Apoi am proiectat aceste costuri pe 5 ani și în final am identificat decalajul de finanțare dintre finanțarea existentă și finanțarea nouă. Următorul slide. Costurile estimate pentru întreg pachetul minim de servicii propus constituie $31,8 milioane pentru anul 2024. Pe termen mediu, furnizarea serviciilor va necesita o ușoară creștere, dar aceasta va veni și cu o rentabilitate mai mare, așa cum vom vedea în continuare. Următorul slide. Aici avem reflectate datele privind finanțarea existentă a celor 5 servicii din pachetul minim propus, care este proiectată pe următorii 5 ani, și necesarul nou, estimat pentru ele în modelul de costuri, care de asemenea a fost proiectat pe următorii 5 ani. După cum vedem, neajunsul pentru finanțarea adecvată a pachetului minim de servicii începe cu $4,8 milioane în primul an și ajunge la $7,8 milioane în anul al 5-lea. Următorul slide. Însă, echipa de experți a estimat că dacă finanțarea este transferată de la îngrijirea rezidențială și este investită în pachetul minim de servicii sociale propus, vom avea economii estimate la circa $5,2 milioane. Deci, dacă se vor face aceste modificări, atunci, în loc de a deservi circa 600 de copii în instituții rezidențiale, Moldova va putea ajunge să deservească în servicii de tip familiar circa 6,2% din numărul total de copii din țară, sau echivalentul a 33.666 copii, deoarece aceste economii, practic, ar acoperi deficitul de finanțare estimat. Următorul slide. De asemenea, există beneficii pe termen lung care vin din investiția în copii. Dacă presupunem că acești copii primesc serviciile de care au nevoie, ei vor putea să meargă la școală și să devină parte a forței de muncă, crescând astfel venitul pe viață pentru ei. Potrivit studiului Băncii Mondiale privind impactul economic al COVID-19 asupra capitalului uman, copiii care au reușit să recupereze timpul pierdut de școală aveau mai multe șanse să-și îmbunătățească performanța școlară și să-și sporească câștigurile pe parcursul vieții. Am efectuat această analiză pentru Republica Moldova și dacă folosim o cifră pentru durata medie a muncii de 40 de ani, înmulțită cu salariul mediu, pe baza estimărilor am constatat că, permițând copiilor să meargă la școală, le vom crește veniturile pe parcursul vieții cu o valoare estimată de $1.397 per copil, ceea ce ar însemna o rentabilitate nominală curentă pentru Moldova de aproximativ $62,1 milioane. Următorul slide. De asemenea, la fel ca și în educație, există randamente și din sănătate. Accesul la servicii de sănătate adecvate este esențial pentru îmbunătățirea sănătății și bunăstării copiilor. Beneficiile sunt creșterea speranței de viață, o sănătate mai bună și o reducere a sărăciei. Folosind un studiu recent realizat de Darudi, care se bazează pe așa indicatori ca DALI, descifrat ca ani de viață ajustați în funcție de dizabilitate, și utilizând indicatorul produs intern brut pe cap de locuitor, am estimat că dacă 33.666 copii ar adăuga 3 ani la speranța de viață, datorită accesului la serviciile sociale adecvate, aceasta ar duce la acumularea suplimentară a $20,3 milioane anual de potențiale economii și venituri. Aceasta este doar o estimare aproximativă. Beneficiile efective măsurate în alte sectoare ar putea acumula venituri mai mari, atât la nivel individual, cât și la nivel guvernamental. Următorul slide. Valoarea actuală netă rezumă beneficiile economice de mai sus și rata internă de rentabilitate din investiția în pachetul minim de servicii propus pentru protecția familiei și a copilului. Rata internă de rentabilitate de 16,6% este aproximativ echivalentă cu rata internă de rentabilitate de 17% generată printr-un studiu privind randamentul unui program de dezvoltare a copilăriei timpurii din Statele Unite. Deși cifrele variază în funcție de context, acestea sunt aproximativ echivalente cu ceea ce ar putea aștepta investitorii de la o investiție cu risc mediu pe un termen de 20 de ani într-o oportunitate din sectorul privat. Astfel, pe baza calculelor efectuate, echipa de experți consideră că există dovezi ample care să susțină o investiție în pachetul minim de servicii sociale pentru copii și familii. De asemenea, există și alți factori care nu i-am luat în calcul din considerente de oportunitate, însă care oferă beneficii pentru țară, cum ar fi consum mai mare și venituri fiscale din creșterea productivității, economii din reducerea problemelor sociale, mai puține sesizări pentru protecția copilului. Vă mulțumesc pentru atenția acordată și timpul acordat.
Thank you, Constantine. Just such amazing work. We're moving from a lot of our discussion in care reform in the past, which has looked at the fact that family-based care is less costly than residential care while yielding much better outcomes for children, to really looking at the human capital piece that Constantine just presented. The internal rate of return, that 17% is an outstanding figure. And it's the kind of analysis that's really driven the early childhood development sector over years of making this kind of case, that investing in children at the youngest ages leads to long-term payoffs. I know that this team was very conservative in their assumptions. They looked at other studies and their methodologies, tried not to overstretch it, and came up with this figure, which may even, as Constantine mentioned, not be a full reflection of the economic benefits of care reform in Moldova. So with that, you all have done an excellent job of responding to my request to go to the Q&A button below and to give us your questions. And so I'm going to turn to those at the moment, but do feel free to continue to add to the Q&A. I've got a team working here in the background that's taking those and ordering them and making them easier to work with, reducing duplication. So please don't be hesitant if you have questions arising to join in there. So the first one, we'll start with a few clarification questions that came from the audience. And the first one I think came up a few times. What would be some of the reasons for the funding not following the child when residential care facilities are being transformed to family-based care, or when the numbers of children in them are reducing so dramatically? So we saw these slides showing the very dramatic change in numbers, but what really explains the difference, the dynamics? Why did those numbers go up? I don't know, Flora, if you want to take that first, or if one of the others. I know several of you were looking at these costs.
Yeah, I think generally speaking, but I'm talking under the control of my colleagues also working in Moldova. But I think first, increasing costs in general were also linked to the inflation, basic economic inflation, and it's important to highlight this aspect. But I think when we look at the cost for providing residential care services, we can see that the budgetary allocation for their services are established following the cost rule and norms of monetary expenses regarding the provision of foodstuff, medicine, clothing, footwear, hygiene and sanitary products, operation cost of the institution. And maybe just also to clarify, when the residential care, the cost for residential care, the budget allocation is made at national and local level, and sometimes with private funding, but still at national and state budget and local public authorities budget. But there is no clear guidelines on the resources to be allocated towards such expenditure per child, as it is the case for family type placement services. So it's, I believe, one of the explanations that can can be provided to explain why the cost really increased compared to the number of children still living in institution, in addition to the explanation that I provided before, that in institutions still we have a lot of children with severe disability, and the cost to take care about these children is also quite high.
So you still have to keep that big, expensive residential care facility running, even if there are fewer children in it. You have to keep it heated, maintained, staffed, and the like. And when inflation hits those particular costs, it's disproportionately reflected on the residential care versus family-based care, where the dynamics are very different in terms of the economics. Is that right? Okay.
Yeah, I can add, yes, as Floris mentioned, and I mentioned in my presentation, in fact, the key expenditures and the main expenditures in the total budget predominate maintenance and the personal staff. Even the number of children is decreasing, the number of staff as usual remain the same, and the buildings and everything. So that's why this, and including inflation we had in the last years. But key is the staff and all costs related to maintenance of the buildings.
Thank you. Next question. You know, a lot of countries would love to see the kind of reduction of children in residential care that you've seen in Moldova. I know the agenda is still not finished, but there's been quite dramatic reductions. Ludmila, can you tell us what were the key drivers for the drop of children really since 2007 or maybe even earlier?
Thanks, Philip. I think several. One is, and very important, is the political will, which was fueled by some of these arguments that we discussed today, for sure. But political will and several important parts of the system which were set up with support, including of the civil society sector in Moldova. Things like gatekeeping mechanism, which were a big part, and an important development. Some of the services that were created, case management, and family support services. So several, really several conditions had to happen in Moldova for the decrees to take place. The political will, the civil society involvement, and several basic services and mechanisms that needed to be created in order to make the DI process possible, including in some periods of time in large numbers.
Yeah, Moldova has been a model on the political will front for many years. So for those of you who don't know it, please do look at the resources we'll be providing to learn more about what Ludmila has been describing. Now, the next question, this is actually coming up in other countries with respect to foster care. So I wonder if you know the maximum number of children allowed in a single foster home in Moldova and how that number would have been arrived at by policymakers. And also, does the needs of the individual child influence the number of children placed in a foster home? And I'll leave that open to anyone who might know the answer.
I can answer. So in foster care, according to the regulation we have in place, the maximum number of children is 3, except in cases of siblings. In family type home, we have 7 children in placement. And
do you know the basis for those figures, or was it just a policy decision that we may not fully understand?
It's according to the law.
Yeah.
In general, yeah.
Okay. Thank you. The next one is a bit long. I'll read it. Please answer the parts you feel comfortable answering, because it's a rather complicated set of questions. How would you evaluate the cost effectiveness of family versus family type care? Is economics the main basis for placing children in group homes? Are you tracking differences in costs and outcomes. And when you document services and costs, you're using the term family type care, which I know, by the way, is embedded in Moldovan policy and law, so it has a formal definition. Do you distinguish between family-based care, such as biological parents, kinship care, foster care, and family type care that is not actually a family, such as group homes or larger foster care? So a series of questions from one of the participants, please respond.
I can start and my colleagues will join. First of all, I would like to mention this because I saw many questions in the chat related to the type of residential institutions, the type of services, what the different type of services, do you mean by them? So it's very difficult to, when you have this very specific topic for discussion, to cover the whole social services system and what happened in country during the last 20 years. So I would say that first of all, it doesn't mean that we, by doing all these assessments, we are promoting. So the key we are promoting is family, is the biological family, and we have a range of regulations and policies in place that are focused on primary prevention, are focused on cooperation of education and health and social assistance system in order to intervene early in the problem of the family. So first of all, key is biological family. After this, as the second stage, is guardianship, guardianship, kinship care in the most known notion, kinship care, and only after this we are coming to foster care, and after to family type home, and residential is the last resort, and it is regulated by law.
Thank you so much. And that leads into, I think, the next question from a participant. Maybe Konstantin would know, or one of the other panelists. What is the cost to the state of a child growing up in their own family, for example, a child with disabilities, versus a child in alternative care like foster care or the family type homes? Did you look at that element, or was that outside of your analysis?
Dacă poate, deci eu pot să încerc să răspund. Deci n-am făcut o analiză acestui aspect, însă care ar fi diferența dintre aceste costuri? Deci atunci când un copil cu dizabilități crește în familia proprie, statul nu suportă cheltuieli pentru salarizarea părinților acestui copil. Deci asta este una din o deosebire. Nu suportă cheltuieli pentru servicii comunale pe care le-ar suporta într-o instituție de îngrijire rezidențială, deci separat. Deci deja alte costuri ce țin de tratamentul copilului, îngrijirea specifică, ce ține de medicamente, consultații medicale, ele oricum statul le suportă, sau când copilul este îngrijit în familia sa, sau când copilul este îngrijit în instituții de alt tip. Dacă a fost clar răspunsul meu. Sau colegii pot să mai completeze.
Any additions from others? The next question then is, just briefly, please, what kind of support do foster care families receive in Moldova? And maybe to describe that a bit.
I think I answer in the chat, but again, Daniela and Lenila or Konstantin can complement. But the main support is allowance that the foster parents are going to receive as well as the child or the children who are placed in family foster care. They will receive also a financial allowance.
Thank you. Another participant is interested in knowing how you've articulated a system for reporting and responding to situations where there's a lack of protection for girls, boys, and adolescents. And if that reporting is accessible to you, and if you've analyzed that data. And I presume this could apply to reporting on children in, say, residential care settings. And I apologize, that question was in translation, so I may not have articulated as clearly as I might. Do we know through any formal reporting mechanism how many children in residential care may be experiencing violence or abuse or neglect?
Yes, I will try to respond. In general, there are no, how to say, there are some mechanisms in residential care related to recording these cases, but I would not say they are working. In general, if we are speaking about residential care, I think the regulation we have in place regarding combating violence and abuse of children, they are not working. So we are, for example, during the assessment, we discovered many cases of this and reported to the state agencies in order to intervene and yeah.
Thank you.
Philip, if I might just add one small piece of information. I think in general, the discussion about reporting, data collection in Moldova is a very dynamic discussion where the government of Moldova is very set on improving the system, both in terms of the technology of collecting the data, streamlining the reporting mechanism. As Daniela said, they exist officially. In reality, the reporting data seems to be inconsistent, where you will have, civil society organizations reporting one number based on complaints that they receive, and then the government official data may present a different number. So it's definitely an area where everyone is talking about the fact that it needs to be improved and streamlined in terms of the information getting to the government in a more consistent manner.
Fantastic.
Go ahead,
Daniela.
Yeah, for general understanding, so we have a regulation in place regarding reporting of all cases. It doesn't matter you are a physical person, professional, or so it doesn't matter. According to the law, you have to report all cases regarding to abuse and neglect and so on. And this is for all in the community, in schools, in residential care, it doesn't matter. So we have the regulation in place, but as Ludmila mentioned, it is not working very well.
Thank you. Now the next, there's 3 questions. I'm just going to lump them together because they all relate to the minimum package. One question is, are we including services and costs related to supporting family reintegration and related to permanency planning for children in alternative family-based care? So that's number 1. The second is someone is interested in learning about mobile teams. What are they doing? What's included in that service? And the third is about where you place early childhood intervention services. Were those costed separately? And do you have a sense of what those costs were? So again, family reintegration and permanency planning, mobile teams, and early childhood. A little bit more of a description of each.
I could just start off with a brief overview of the reintegration costs. While never fully included in the costing, but they are included as part of the family support service in Moldova, which is meant to be the main service providing reintegration support and case management for children reintegrating from residential care. So these costs are all grouped under the family support services, which in the investment case report, they were included in this minimum package of services. So yes, the short answer, they are included in the family support service.
Great.
But in the DI process in general, we have to acknowledge that we have to have transitional costs because the family support payments that are included and regulated, they are not sufficient. So as usual, civil society is supporting all this process and is covering the transitional costs in terms of reintegration or services development.
Other comments on the minimum package?
Da, în privința la echipa mobilă, aș dori să completez. Deci echipa mobilă este o echipă formată din specialiști ca kinetoterapeut, logoped, psiholog, care merg la familiile unde sunt copii cu dizabilități care necesită intervenția și ajutorul acestor specialiști pentru a-și spori abilitățile sale de mișcare, de comunicare. Și este o echipă specializată care merge la domiciliu pentru a acorda asistență copiilor cu dizabilități.
Very helpful. Thank you, Constantine. There's also a question about, has there been any large-scale activity on gaining feedback from children and young people about the transition from residential to family care? If so, what have you learned from the feedback?
I can get started, and I'm sure colleagues can add based on their own initiatives. I can share the initiative taking place actually in changing the way we care. We call it a household survey that we are actually now completing, and it is about going back to children who were reintegrated from residential care into family-based care and getting their feedback on well-being and changes that happened based on their opinions since returning into family-based care. So the report is not out yet. Preliminary results are very positive, and we consider this one of the important new elements of evidence that will be used in Moldova's advocacy dialogue for advancing care reform.
Maybe I can add something quickly. I think not only in the process of DI, but in general, there is a will in Moldova and in other countries to improve child participation regarding the quality of the social services in general, and to make sure that not only for the work done by child protection CSOs, for example, or NGOs, but also the governmental services. So this is something that I think need to be still improved, including in Moldova for the DI process. Also, one thing that we are interesting as UNICEF, but I know also actor to explore, is the gender dynamic behind DI, regarding also the impact on women as mother, but also as caregivers and social workers, because the majority of caregivers are women and social workers in Moldova are women also. And it's interesting also to add this component to make sure that we address also the specific needs of mother, of caregivers in terms of prevention of family separation, but also in the reintegration process. So it's another aspect that little by little we explore in terms of analysis.
Thank you, Flora.
I would
Helpful.
like to, I would like to add that starting with 2007, in general, the whole reform, in the whole process of the reform, children and families were part of this process. And we had different type of surveys, including longitudinal reintegration surveys, surveys done by government, because we are speaking now that we had political will, but it was very difficult in order to maintain this political will with fluctuation and changes we had in Moldova every time with parties and governments and so on. So this component was a critical component every time under the loop of the government in order to see feedback of the families, feedback of all stakeholders involved in the process. And we have different type of models of child participation models, including in the country, including advisory board of children that was established starting with 2011 with USAID support, and still we are supporting this model. Children that are prepared to monitor services, to provide this valuable information to social assistance department regarding views of children from social services.
Thank you all for the responses. And as we close, I have a high-level lightning round question. I'll have to ask you to be brief given our timing. But I want each of you to imagine that you are part of a delegation to a foreign country on a completely different continent. It doesn't matter which continent. And you are sitting before a group of representatives of different social ministries and funders and the like, as we had in Moldova. Very quickly, and building off of each other's answers, what's the one lesson from Moldova you would want to share? The most important thing you would want that audience to know in another country, since we have such a diverse audience here today from around the world. So I am going to start with Ludmila in the lightning round. Sorry for picking on you. What is the one thing you want to make sure that they hear and take away from that meeting?
That family-based care is not only possible in any environment, under any conditions. It's not only possible, it's actually highly recommended, not only because it's in the best interest of the child, but it is more cost effective. And for Moldova, we have very specific numbers. It's 14 times more cost effective to provide family-based care, community-based care for children as opposed to residential institutions. So it makes sense in every single way, and we have a good example of this actually happening.
That's great. Now, Flora, you've heard Ludmila's point. How would you build on that in that delegation?
I will go maybe beyond the DI, and I will mention that what is needed is a strong political will to invest in sustainable child protection and social system in the country. And I will highlight the cost of non-action, actually, showing that cost of non-action is definitely higher than doing investment in child protection system.
Constantine.
Da, eu aș spune că, practic, tranziția de la îngrijire rezidențială la îngrijirea în mediul familiar este una care aduce economii de resurse financiare. Însă, perioada tranziției este mai costisitoare, deoarece statul va fi nevoit să finanțeze paralel și instituțiile rezidențiale în proces de dezinstituționalizare și serviciile noi create de îngrijire de tip familial. Dar odată cu transferul complet la nou tip de îngrijire, deci vor avea mai puține cheltuieli sau vor putea aceiași bani să-i folosească pentru a îmbunătăți calitatea serviciilor de îngrijire de tip familial. nu fac economii pe seama copiilor, dar banii economisiți se utilizează mai eficient și cu un rezultat mai bun pentru viitor.
Thank you, Constantine. And Daniela, you get to close the delegation off with the last key message.
I think the key message I would have is to believe in the change, not to lose the hope, because only by believing in something and fighting for this, you can succeed. So believe.
That is a great closing note for the delegation. And as we wind up the panel, believe, and I think this Moldova story has given us a true reason to believe, to think about ways that this could be replicated in other countries. I've been asked just for a few last observations, and I'd say, what I've been taking away from today is just the importance of taking really good technical work in care reform, really solid work that's been underway in this country context, and then really explicitly linking it to the question of resources, so that we don't end up with another report showing all the different elements of the system that we need, but we help the government to stand on its own 2 feet to provide those services. So incredibly important. And the other piece in Moldova to think about in other countries is they brought the right people in the room. They weren't just talking to the social ministry. They were talking to a multitude of ministries. This is a cross-sectoral agenda. They were getting finance in the room. And Moldova, like most countries on this call, I'm sure, is dependent on external financing. They need funders like the bank and other players to come in and to support their budgets and the policy priorities within their budgets. Moldova, this team figured that out and got the right people in the room. Domestically important people involved in budget prioritization, but also external funders to understand why this is so important. The third thing is that this is not a one-off exercise. So we didn't hear as much about it, but I know that it took a lot of work and a lot of consultation to get to the June convening, but then you just keep at it, like the health sector, like the education sector. They don't just present budget needs and then let it go. They need to advocate for budget day by day, week by week, month by month. And then finally, as Constantine closed us out with, care reform pays off. A 17% internal rate of return, conservatively calculated. Just like in early childhood development, these kinds of returns should be shown in other countries. It's you can look at the analysis, you can potentially criticize it, but it's highly intuitive and it's consistent with what we have in terms of global evidence. So with that, I would want to thank the 4 presenters. Please, a huge round of applause. You can send up your, hopefully, I don't know if we can do reactions, but listen, panelists, they're all applauding. You did a fantastic job. Thank you. I want to remind you that we will be sending an email with a copy of the recording of this presentation. Please share it with anyone you think might be interested. We'll be sharing the slides, and we'll be sharing a resource page. Oh, there's the thumbs up and applause. Thank you. A resource page where you can have direct access to additional information. And with that, we will draw this webinar to a close with a huge thanks also to the collaborative for the excellent organization that went behind it. So my best to you all, and let's take this agenda forward. Thank you.